So just wanting to welcome everyone into this space. My name is Angela Brand. My pronouns are she, her. You are in the session on peer provider panel, the working at the intersection of behavioral health crisis and disaster support. We've got our presenters, Ragini Lal, Noelle Perez, and Juan Acosta joining us today. I'm going to go ahead and turn it over to our presenters today and give them a chance to introduce themselves to you. And we'll go ahead and start with Juan.
Hello, everyone. I'm Juan Acosta. My pronouns are he, him, his. I am the regional manager for the Cal Hope Warm Line with the Mental Health Association of San Francisco.
Hi, everyone. My name is Noelle Perez. I am the Director of Program Development at NAMI Santa Cruz County.
Hi, y'all. Thank you for joining us this afternoon. My name is Ragini Lal. My pronouns are she, hers. I am the Director of Workforce and Community Engagement at NAMI California.
Just a little bit about the session that you're in here today. The learning objectives are to understand the current landscape of how disaster and social crises have impacted individuals, families, and communities in general, as well as those with pre-existing behavioral health needs. Additionally, we'll be looking at strategies to providing warm line supports addressing both behavioral health crisis and disaster needs. And finally, looking at how to identify available community-based resources and supports for prevention, intervention, and postvention. We'll go to the next slide. And we'll start off with a simple one, which is please describe the services provided by your organization. And we'll start with Juan.
Yeah, so the Mental Health Association of San Francisco has a variety of resources. I currently work as the regional manager of the Cal Hope Warm Line, as I said, but we in fact operate two warm lines, one of them being the California Pier 1 Warm Line. And for folks who may not know what a warm line is, it is different to a crisis line. And folks throughout the state are able to call in and receive support from a peer provider, where they are able to speak to someone who's had a struggle in their life before and connect at that level. At the Warm Line, we usually also provide folks who call in with resources. In addition to the Warm Line, we also have a variety of different peer support groups and conversations, including hoarding, peer support groups, Real Talk, which focuses on different conversations around LGBTQ plus health and health equity as a whole, and other BIPOC support groups as well.
Thank you. And Noelle, if you'd like to share a little bit about your organization.
Yeah, thank you. Yeah. So NAMI Santa Cruz offers hope, empowerment, compassion, and inclusion through education, support, and advocacy for those affected by mental health conditions and their families. All of our programs are free of cost to the community, and we also offer a helpline in English and Spanish. We do call ours helpline just because in Spanish it does sound a little better and people understand it a little bit more when we use the term helpline. That's one thing we have found here in our community. And we also offer classes, which I mentioned. We have classes for family members. We also have classes for peers, those that have a mental health condition or are experiencing mental health. We also provide a NAMI provider education for providers. And we have a class for parents of youth. We have support groups for family members, peers, and parents of youth as well. And that we offer presentations for the community and for schools. We do offer a Ending the Silence presentation for prevention in the schools. And it's for students, teachers, and parents.
Yeah, so at NAMI California, I mean, Noelle did an amazing job covering like the bulk of the work that NAMI really stands out for. It's our signature programs. They're all free. The education classes and the support groups are offered for peers and family members. NAMI California also is heavily involved in, policy reformation and changes and advocacy, as well as community engagement and just kind of the delivery of programs. We also offer a lot of cultural competency and warm line trainings and various trainings for affiliates and organizations, and also for family members and peers. And one of the main bulk of NAMI California's work recently related to the intersectionality between like crisis care or disaster response and mental health and behavioral health services is we've been part of the Cal Hope Crisis Counseling Program. That's been funded by FEMA, really developed and organized by Cal Mesa. And we offered it for a program for COVID and for wildfire, and I'll expand more on that as we continue our conversation, but a lot of things that we do.
Thank you so much. And yeah, just to sort of tie all that together, really bringing these folks in for the conversation, largely thinking about the Cal Hope program. And for folks who are new to the conversation or maybe unfamiliar, Cal Hope is a program run through the Department of Healthcare Services, providing emotional support to individuals and families impacted by COVID-19. They also administered Cal Hope for those impacted by wildfires. And so we'll touch on that throughout the conversation. Excuse me, but really just want to have a chance to highlight the incredible work that Juan and Noelle and Ragini's teams were doing in support of that program. So, which leads us into our next question, which is, how have community needs changed as a result of the COVID-19 pandemic, wildfires or other disasters, social justice issues, and or community violence impacting programs and or the people that you serve? We'll start with Juan.
Thank you, Angela. As you just mentioned, there's been an overload of things happening in the state and in people's communities that have really impacted them. Our programs in particular have been impacted because there's been more of a need for the resource, meaning that sometimes people have to wait longer for a call at times in accessing the resource due to that. Another change has been that we have had to get really specific about the level of support that we're able to provide for folks and how we address what folks are calling in about, because it is very specific. It can be due to them needing financial support due to the pandemic. It could be because their home has unfortunately been in a fire, and other social justice issues as we've seen these past few years as well. So things have gotten really specific. And so our approach has to change as well as things get more specific. And in order for us to truly serve the community, we need to be intentional in the way that we change and shift our program to address these needs. And that is something that we have been noticing for the overall program, and just the longer wait times. As I said, the higher call volume, the more that we are able to really emphasize to our stakeholders, to the state, et cetera, that this is really important and that people want to use the resource, but sometimes there isn't enough folks there to support them.
Thank you. Yeah, I think the more that we get into this conversation, the more that we'll see like how complex the situation is for folks accessing care, just by sheer nature of everything happening in the world. So I appreciate you sharing that. And we'll go to Noelle. Anything that you want to share on this?
Yes, thank you. Yeah, with some stuff that we have seen in our community, it's been a very tough past 2 years, or a little over 2 years for everyone. And some of the changes that we have seen is an increase in youth mental health supports. So we have noticed more parents of youth joining our support groups and on asking, seeking services for youth. We have also seen a lot of people feeling isolated, feeling alone, finding it harder to get connected to providers. We have also seen the digital divide. I know here in our community, when the pandemic hit, there was a lot of people that were left out and didn't know how to connect to services. So what we did, we called each one of our participants and we asked them if they had ways to connect online. And those that didn't know how to connect, we provided laptops and we went over Zoom. We spent hours going over how to use Zoom. So we really wanted to find ways to get them connected so they could utilize services in the new world. We also saw an increase in homelessness, and we noticed that there was a lot of people that were scared to lose their housing. And we also received a lot of helpline calls related to homelessness. But despite all that we were exposed to, we also saw opportunities to collaborate with our behavioral health department, to collaborate with our local clinics, to collaborate with the state, with NAMI California, and to work together for the well-being of people.
Thank you. I think you highlighted something that I want to elevate, which is just in this space, providing the supports is even thinking about having to, teach folks how to get online and access Zoom and some of those things that aren't necessarily connected to behavioral health or mental health or physical health, but just it's part of that piece of increasing folks' access and experience. And so just how important those small gestures are. And really appreciating the reframe around how sometimes in this, we've heard a lot over the last few years about how difficult this space has been, but reframing it in a way that we see the opportunity to step up and do things in a different way or collaborate with different partners, and just really appreciate that as well. Ragini, do you want to step in on this one?
Yeah. So through our programs and just kind of more statewide, we've seen obviously a really higher prevalence rate of mental health challenges, and the diagnosis plus the severity have increased for people who've already experiencing mental illnesses before the pandemic. And now we're even noticing that, like a personal story of mine is I noticed that even folks who never talk about mental health, it's a stigma, will kind of speak about it in a way that we, mental health advocates might not speak about it, like saying the words mental health or talking about suicide prevention and things like that. But they'll say like things like, oh, it's scary, I don't have any human connection, I feel sad and lonely. And those are the words that you'll hear from a lot of peers and family members and individuals out there who, while we didn't think about this before, so it was such a huge shift through the pandemic and wildfires, and then just the other disasters of social justice. One of the key things that we noticed is that state and the country were basically not prepared enough to provide immediate disaster resources and mental health challenges as soon as the world kind of went in a different space that we're at now, and it kind of pushed behind the focus of behavioral health and mental health services, because everyone was focused on resolving the pandemic just in that itself. And so the programs that we had, they served the folks in a way that it was immediate, and that was kind of the focus that this has to also be an important topic that needs to be addressed as soon as possible, and not something that's post. That's something that we see happen in a lot of services, as a lot of people get care post criminal justice incarceration, or post what's called psychiatric rehabilitation. I'm sorry, I cannot speak today. And then the one thing we noticed the most is that the needs became really blurred and kind of complex. It all kind of like meshed together. And then even just people who are watching social media and seeing all the social injustices happen can really take an impact on our own mental health, and sometimes in ways that we don't realize, and also blurring work and home life together. So the complexities of the communities that they've been having to suffer through and going through multiple traumatic events in such a short period of time, and also becoming such a large scale thing is what we saw the most. It's just the increase of how much it's needed and how much more we should think about having mental health services that are more preventative rather than having to talk about it afterwards.
Absolutely. I think having been in a few other sessions today, thinking about something that you said that really stood, the complexity of what we're in, and the different focus that we've had, whether it's addressing the pandemic or helping folks get online, and those multiple traumatic events. Someone in a previous session called it compounded trauma, and just really thinking about how the pandemic did elevate these conversations. And it leads a little bit, we'll go to the next slide, which leads a little bit into this question, which is, how has your organization shifted practices to respond to the intersectional needs of communities in crisis? Thinking about some of the things you've already shared, Noelle, but wanting to come back and open this back up. So Juan, if there's anything that you want to share on this.
Yeah, I think for this, what we have done at the organization is update our resource database immediately to make it more diverse so that we can have as many resources as possible, going back to the spirit of collaboration that Noelle mentioned earlier, ensuring that we have as many resources, as many partners as we can in different communities to support the folks living in them. In addition to that, we have continued and expanded our outreach so that folks from communities who may really be impacted by some of these social justice issues, wildfires, et cetera, really know that there are resources out there for them and how to utilize them. And lastly, I would say that we have continued our education component of our training with our own staff so that they are aware of these issues, but that they are not just aware that they can take action and know how to address them when they do come up on these calls and how to support the callers through them.
Thank you. You were talking about, the increased education and really bringing our teams up to speed, and how important that is to make sure that those that are providing support have all the information that they need, and really bringing in, opportunities to learn about some of the spaces where we haven't historically worked, because we've just been sort of in that silo of, behavioral health or mental health. And so just recognizing the nod to your leadership, to bring in those supports for your team is really important. Noelle, do you want to go?
Some of the things that NAMI Santa Cruz has done to meet the needs of our community is, thanks to the CalHope grant, we were able to hire bilingual, bicultural staff. And ever since then, we've been out there doing outreach at our local farmers market every week. We've been out there providing resources in English and Spanish. So we make sure that, we are providing cultural responsive material. So we make sure that we create flyers that meet the needs of certain groups. So if you visit our table at the farmers market, you will find different flyers for our different audience that come to our table. We have also, like I mentioned, collaborated with our local clinic, our behavioral health department. So instead of working in silos, we join their monthly meetings. We try to find ways that we could work together. So like that, we're all become part of that circle of care for families and individuals. And we have also made our Spanish helpline available Monday through Friday, and it's a live phone call. So you could call and you get connected to someone that is a peer themselves, and they provide compassionate support. And they not only connect you to resources, but they also do the warm handoff. We have found that is very important for families, that we connect them to an actual person, a name and a phone number, instead of just letting them know, oh, here's this resource for you. We have found that it's very important to do that first steps with them. And we have found them calling again, and we just make sure that we're there to answer their call and meet their needs.
Thank you. Yeah, and I'm thinking some of the things that you're sharing now kind of also speak to the next question, but want to open it up to for Ragini to share a little bit about the work that NAMI California is doing in this space too.
Yeah, so a lot of the work that's really been, high priority is advocacy, more on a statewide level. Specifically over the last couple of years, like home housing needs have increased heavily based off the wildfire disasters, the pandemic, the increase of economic rates currently, as well, even post-pandemic. So housing needs has been a huge advocacy need that we've been working with priorities and policies to get more housing for across California, as well as criminal justice for the social justice aspect of things, really doing trainings. We had a program called NAMI Cope, where it provides like support groups and trainings for the law enforcement in order for them to care for their mental health and and provide and break that stigma so that they are able to increase more of a compassionate and encounterments with when they encounter their folks out in their workforce. So there's that as well. And then crisis services, of course, is also a big deal. For, as Noli mentioned, the Cal Hope program was something that really helped us really understand how to meet the needs immediately. One of the program partners that we have, Mental Health Association for Chinese Communities, really highlighted on understanding working on the ground as a full mobile crisis Orange Patrol team. They call it the Orange Patrol team. And they have been so successful and recognized in being able to reach the communities where they are. And regardless of all the disasters and the crises that we went through over the last couple of years, it really highlighted when there's a crisis occurring that there needs to be someone who's a familiar face. And the amazing thing about this Orange Patrol team is that they were all folks of diverse communities that are bilingual or multilingual and able to provide that warm handoff and resources and provide a more trauma-informed and compassionate service at that moment. And then kind of build continuum care after that. And they really were they've been doing it in Oakland, Chinatown. They really have been also trying to reduce anti-Asian hate as well through this program as well. And Angela, thank you so much for putting in MHACC. I know we did a webinar with them as well from the CARE TA, so please go check out the CARE TA website to check that out.
Yeah, so I think this is a good segue into the next question. And really thinking about some of the opportunities as you're all partners on the Cal Hope project. And, as we said, Cal Hope is, it's a program administered by the Department of Healthcare Services. It's funded by FEMA and SAMHSA. And the COVID program was put into place to provide emotional support to families, individuals, and communities that were impacted by COVID. And one of the really great things about the Cal Hope program was there was a lot of flexibility in how folks were interacting with community members. And so thinking about, respective to each of your organizations and for Ragini with NAMI California, who has multiple partners on the Cal Hope program, really thinking about how there was, kind of this out of the box opportunity to provide supports to folks sort of outside of the traditional, hotline, warm line, helpline approach. And so just inviting you to share a little bit about that. And we'll start with you, Juan.
Thank you for this. Like Noelle said, we also do the warm handoffs. I think that builds rapport and trust with the community members. But we also really like to meet our callers where they're at. And we like to ask them what kind of support they need in that moment of crisis. And for us, it's really important to utilize the resources in their communities, whether it's us, as Noelle said, we warm transfer them to either a peer support group where they're able to schedule a meeting with them, or we're able to support them by getting someone from mobile crisis to go to them and support them. Historically, what we've heard on the line is sometimes people have trauma with the justice system and they don't want an officer to show up to their house. And so being very conscious and self-aware about that at our program is something that we've been really emphasizing for all of our counselors and for our staff members. More than that, we encourage our callers to call back. We are open 24/7 at our warm line. So the support is there 24/7, 7 days a week for folks. And that is something that we really try every single call to re-emphasize for those folks so that they don't think it's a one-off call and that they're welcome to call at any time.
We've heard a lot over the course of today about how important it is to meet folks where they're at, and really just wanting to continue that theme here in this conversation and elevating that. Noelle, do you want to share a little bit about what NAMI Santa Cruz is doing in this space?
Yeah, so again, our helpline is really the place where families do that first connection with us, and is a place for them to talk about their worries, to get connected to resources. And one thing that we do, we follow up with them, and we've been able to do that thanks to the Cal Hope grant. We follow up with families and make sure to check in on them and see how they were doing, if they were able to get connected to someone. So that's one thing that we felt that has really helped us build trust with them as well, doing that follow-up call with them. And we have heard, people mentioning like, wow, thank you so much for calling. Like, I feel so good that, someone's thinking about me, someone cares. And we have heard that several times when we do that follow-up call to check in on them. Another thing that we do to connect families is we also try to meet them where they already are. So for example, we have our support group every Tuesday night. So we see that there's something that, like a common topic or someone keeps talking about, resource they really want to connect to. We invite them to our support group, and they come and talk about their services for 20, and they have a Q&A at the end. So that's another way that we've been able to connect participants to local resources by inviting them to the space that they're already in and feel safe in. So that's been very important for us, and we have seen that families really enjoy that when like, I really want to learn more about, how to deal with the COVID-19 stressors. I know there was a night that we talked about that. We also talked about self-care tips. We bring in behavioral health has they've been to our space and talked about their services.
So, Juan and Oli did a really good job really summarizing. It's very similar to kind of what we also do. Is one of the main key things is that we do have 52 local affiliates, and then NAMI California is more of a state level a chapter for the whole NAMI, like the national NAMI that we have. And we really rely on the expertise of the local CBOs, community-based organizations, and our affiliates, all the local NAMI affiliates, because in order, on a statewide level, in order for it to meet people's needs and to really hear for them is one, we're also, as well as, and Noelle said, really wanting to hear from the community and what they're going through, and then also connecting them to the local expertise who could really help them, meet them where they're at, and have that capacity to as well. So the affiliates is someone and we really refer them to our affiliates a lot because they have all the expertise. They know the providers in the area. They understand the support groups that can be offered, the education classes that can be offered. And so we really, really heavily rely on them, and are very grateful for them. And another thing is how we support them, but we'll talk more about that in the future questions. But warm handoffs are also really important. One of the main things that we do is also increasingly make sure that our resource lists are constantly updated. And then the resources are also have the capacity to intake clients and individuals who are being serviced. And so those resources are constantly updating, and we want to share that out and really be collaborative with other organizations or affiliates on making sure that the resources are getting to the consumers and the families. So updating that resource is something that we've been working on heavily. And then also our counselors and our staff are really doing refreshers and retraining them on like emotional culturally responsive support and supporting them as well, and to help them able to navigate when they receive calls or when they meet someone in person or whoever else they encounter the community out there. So we're also internally supporting folks as well, our affiliates and our own staffs.
Just to highlight for a moment, the network that NAMI has is really fantastic and fairly unique for a state level organization. The affiliates work across the state and really provide hands-on community-based services that then roll up in partnership with NAMI California. And so it really provides the opportunity to meet a lot of folks right where they're at. And I'm hearing, you know, the updating of resources and really thinking about the various types of resources that, you know, are needed by folks and informed by the community, informed by your engagement as folks are contacting your, you know, warmlines and your organizations. And I would just say we've, you know, put some information about the organizations in the chat, but if you have any specific links to those resources or anything that you want to direct our attendees to, go ahead and drop that in the chat. So you've talked a little bit about this, but if there's an area where you want to highlight, you know, more specifically, some of the resources or programs that you provide that assist individuals and families experiencing behavioral health crises. And it's kind of dovetails also into question 6, which is some of the resources that are provided to folks that are in need, that might be experiencing distress as a result of the pandemic or other disasters. And so, you know, I know NAMI has a standard list of programs and supports that they offer, but thinking about those as they intersect with, you know, either COVID-19 or some of the other natural disasters, would just invite you to share about that. And so we'll start with Juan.
Yeah, I of course have to say calhope.org. I'll put the link in there. There's a lot of resources on there that have been really helpful for our community, and it ranges as well with the variety of resources. In addition to that, as I mentioned earlier, for folks in crisis, we really do like to look into alternatives to police and really give the resources that our community focus for the folks calling in. We also like to have our resource database really up to date with the most up-to-date resources of folks of diverse communities, like the Trans Lifeline Trevor Project that can focus on supporting LGBTQ+ callers who may be calling in for the first time and who want to speak to people who are just like them, who may represent them and make them feel more comfortable. So we do that as well.
Wonderful, thank you. And yeah, I dropped the link for CalHope. There's also another resource page, Together for Wellness, that was created out of the CalHope program that has a lot of supports for families and various diverse populations. And so we'll go ahead and keep sharing those resources here in the chat. But Noelle, I'd like to turn it over to you for information on what NAMI Santa Cruz is doing.
Yeah, thank you. So we also do use CalHope a lot. A lot of our CCP counselors use that to refer people. We also use, we connect them to MERDI, which is a mobile emergency response team for youth here in our county. And we also, you know, help them how to request a mental health liaison when their calls are for police intervention. We also, when they're asking for how to do a welfare check, we also help them with that. And then we provide how to fill out a release of information form when an adult loved one has been hospitalized or placed on a 5150. We also provide education on how to navigate the mental health system. So when their loved one needs to go to telecare. So we do provide them information on that. And we also make phone calls with them. And then we give them access to NAMI Santa Cruz. Actually, one of our volunteers created a jail guide that I would love to share with you. And sorry, Angela, I forgot to send that over to you, but I'll send it right now. And we definitely use that to provide to family members that have a loved one that has been arrested. And another thing is that we connect them to our local resources, mental health resources here in our county. And yeah, lots of resources.
Yeah, I definitely, I mean, Cal Hope has a trove of resources, you know, but definitely in my experience working with NAMI, the affiliates keep pretty extensive resource lists and work to develop a lot of guidance to help folks navigate the system, whether it's the justice system, the behavioral health system, the education system. I'm really just thinking broadly about the work that we do and how important that is to have someone help us in those spaces, know where we need to be, how to advocate for themselves. Ragini, you were talking earlier about the advocacy work. And I know, Juan, you're very modest, so you probably won't bring it up, but Juan does international work in an advocacy space and is a phenomenal advocate working all across the world. And so just how important that is to have folks that are doing this work to lead others and provide those supports and resources, just, you know, really wanting to like elevate the work that you're all doing and how important it is for individuals and families. And as you had said, Noelle, you know, the young people whose families are, you know, needing supports for the, you know, the students and youth in their life. And so just, you know, these questions are here, but really the impact of having those resources available is just so incredible. And so thank you for all the work that you're doing in that space. And then, yeah, so Ragini, if you want to talk a little bit about what NAMI California is doing, and if there's any information you want to share. I know that the wildfire program has already closed out, but if you want to talk a little bit maybe about some of the work that folks were doing in that space as well.
Yeah, of course. So I'll answer that second question. The wildfire program was essentially the same as like our COVID program. It was, you know, specifically for areas and counties that have been most affected by wildfires. So we had a huge team, like, well, not a huge team, but we had a team of counselors, and they did an amazing job putting together resources and materials together to be able to provide to folks that are needing these referrals and needing to access resources. I need to find that it's a pretty large document. I will find it. I'll send it to you. Angela, I'm not sure if there's like a follow-up resource list we can send to all the attendees. There's that. And then we also have another resources list in-house that covers across of like a bunch. It's built on like a bunch of different like topics, such as like homelessness, crisis, things like that. We also have that listserv, and it's also a pretty large document. Again, once I find it, I'll either put it in the chat or I'll send it to you, Angela. And so there's that. And then I also want to mention findhelp.org. That's been a huge help for a lot of the folks that I've encountered. And when I used to do crisis counseling before, I used to use this website pretty often. Yeah, Angela, thank you for putting that in. It's really simple. You put in the zip code. It's very local, and it has an abundance of resources, not just about mental and behavioral health care, but also if there's other type of services, even like for mothers who may need, childcare, or for, moms who are, like family members who just need to be able to access a specific resource. It was previously referred as AMPRITA. And then lately we've actually been using the CareTA resource library. It's super easy to navigate. I think that, so we've been using that pretty often as well. And then again, you really refer on your local affiliates to have their expertise and to be able to provide services to individuals and families. And the CalHope Warm Line, the CalHope website's already been shared, and that's something we've used pretty heavily as well. Yeah, there's quite a few.
No, thank you so much. And really, thinking about how sometimes half of the, the barrier is not knowing that the resources are out there. We could probably talk the rest of the day about the challenges that folks are facing accessing services and finding the appropriate services to support their individual needs. But really thanking, all of you for sharing the resources that you have, because a lot of work goes into pulling those together and making these widely available. That was one of the things about the CareTA resource library, and that was a lot of the resources that we have in there came from our NAMI partners and came from the CalHope work that was being done. And so I'm really just thinking about a way to corral all of that and make it available. And so that's really a nod to the work that you're doing to collect those. And so, and the thinking about the wildfire work and the COVID support, and grateful for an opportunity, as Eliana Ramirez, our project director, shared at the beginning of today's session, just how we're now at this really unique opportunity to talk about how there is an intersection between behavioral health crisis and disaster. Historically, they've been separate, but we've known for years after Katrina, after some of the other things that have happened now with California and the wildfires and some of the other climate violence that's taking place, just in the midst of a disaster, there's a lot of stress and a lot of anxiety, and that can bring on additional, crisis, that can exacerbate crisis for folks that may already be in a delicate place. And so just thinking about how we're reorganizing our work to meet the needs of folks that might be experiencing crisis in multiple places is just a really important piece of this conversation. So we'll go to the next slide, and thinking about how all of the amazing work that you're all doing, and thinking about folks that are joining us in the room today, and no doubt the work that they're doing in their communities, and how we give of ourselves, but how are we taking care of ourselves is also a really important question. And so, inviting you to share about how, we think about this. So staff burnout and compassion fatigue are common across behavioral health staff. The high stress of crisis care is no exception. And thinking about what strategies that your program is using to provide respite care for staff. So Juan, will go, anything that you want to add here about what you all are doing for your team?
Yeah, thank you, Angela. I think as a collective, we've been on survival mode for these past few years now, just with so many things going on in the world. And I think for us, it's really important to recognize it to our staff and to name it to them. I think sometimes these things go unnamed, and people clock in and clock out. And for us, we do not want to build a culture around it, but we want to validate everything that's going on and go through it with them together. I think for us, holding space for their feelings, having an open door policy to check in with their supervisor, with their peers around them about how they're feeling has been really important. We also have peer support consult with them, where they're able to talk to one another about how the job has been impacting them, what they've been hearing from callers, and collectively come together and just kind of feel those feelings. And that has been really helpful, and we hear great things about having that space for them. We also encourage folks to use their time off, to take days to not come into work if they're not feeling great, and to just really look after their own mental health needs, because in order to support anyone else, you first need to feel like you're being supported yourself. And so that's been really important for us to do as well.
That's so important, to take those, it sounds simple, but take those days off, recharging our own batteries. I think we use the analogy a lot, if you fly somewhere on an airplane, they'll go through the steps of like what happens, and you have to secure your oxygen mask before you can move on to help someone else. And so I think, we have to be whole and well in order to be able to provide those same supports to others. So I think that's a really important thing.
Yeah, and I would also add, like, we ask for their feedback as well. If they feel like we can be doing something better on our end to make their job a bit easier or a bit less heavy on them, we like to listen, because we know that they are the ones who are answering those calls. And for us, their perspective and their opinion leads the work that we're going to do. And so that's really important for us to do, to listen.
Absolutely. Thank you. Noelle, do you want to share a little bit about what your team is doing?
Yeah, thank you. Juan already touched on some of the things we're doing, but I'm just gonna add here. Here in NAMI Santa Cruz, we'd like to say that we are staff-centered organization because we really do care about the well-being of our staff. So what we do is, like, we really look carefully at each one of them and see what their workload is, what can we do to support them. We also provide a mental health stipend where, you know, they could use it towards a therapy session, a massage, something that is gonna, you know, help them, you know, thrive with their work. Because I know that all of our staff are really caring people, and they really want to make a difference in the people that we serve. So we really want them to take care of themselves, and in order to do that, we encourage them. You know, even with meetings, we start off like, what are you doing to take care of yourself this week, or what have you done? That really does open the conversation to, wow, I really haven't done anything for myself this week. I need to do that for myself. And yeah, so really having those open conversations about self-care, about workload, you know, not being afraid to ask for help, not being afraid to ask for questions, for clarity, really supporting each other along the way. Like Juan mentioned, we are all in this together. We're all trying to manage, you know, all the things happening to us. So we really want to, you know, deeply listen to their needs and find ways to make it a better working space for them. And 90% of our staff does identify as a peer. So they have a mental health condition, or they're experiencing mental health themselves. So we really do want to make sure that they're taking care of themselves and taking the time that they need to be able to, you know, feel productive and just do the great work that they're already doing. Yeah.
Thank you. Ragini, do you want to share a little bit about what your team is doing?
Yeah. So for the CCP Counselor, the Crisis Counselor program for the Cal Hope, we have a few counselors in-house as well, along with our partners, but we hold weekly support groups from them because burnout and compassion fatigue is, you know, such a high prevalence rate amongst all the behavioral health staff, especially those who have direct, you know, either clerical or clinical experience where they're on a day-to-day hearing all the hardships that all these human beings are going through, and everyone who usually is not everyone, but most folks that are usually in behavioral health and mental health are people who are empathetic and care, and that could really, you know, make a huge impact on their own mental health. And all the counselors that we had are all, you know, 100% peer staff, and so we hold weekly support groups where they just talk about their specific unique needs that they, you know, experience in their workforce. We also have mental health days that we offer, and, you know, Juan and Noelle already kind of mentioned a lot of amazing things that we also do, and then we also ensure that they are always feeling open, and then having, you know, with every week I usually with my staff have an hour of just talking about life and the things that are happening in the world, and honoring those spaces and being open and honest about, you know, the recent mass shooting that happened at the school, and then you know, all the amount of school shootings that have happened recently, and just really honoring those spaces and honoring like what every individual, every staff member could really feel about it, and how they might even have different experiences. We try to, when I try to have those one-on-one meetings, Noelle said you also, do that with your staff as well. Sometimes I'll even ask them if they're ready to even talk about it, if they're ready to even like discuss their week. Sometimes I don't want to ever feel like I'm being forced into having to talk about my life with my work every week. So sometimes we give it as an option and an opportunity rather than, hey, I need to know what's going on with you. And so, yeah, there's a lot of different things where we really want to honor the amazing work that everyone does and all the individuals do. And as leadership as well, we're also trying to take care of each other, because it really does impact all the folks that we have, all the staff that we have that are really doing an amazing work. That we then leadership and then the community wouldn't be able to have without all these folks. So really taking care of each other is one of the best ways of reducing staff burnout and compassion fatigue.
And just a little shout out, Ragini did a training on compassion fatigue through the Care TA Center, also did some self-help in the holidays training. And so just thinking about the skill that you have in recognizing how important that part of our work is, and how you've shared that knowledge with folks through this project already has been really helpful and was well attended. We got great feedback, so it's definitely resonating with folks. But also something you said that I want to elevate is, giving folks the option to talk about it. Having the space and creating that for folks is incredibly important, but it's also really important to let them do it at their own pace. And if they don't want to, and normalizing that that's okay as well. So we have just a few minutes left, about 6 minutes actually. We have one more question, which is what recommendations or words of advice would you give to those who are providing services in their local communities? If you want, we'll just briefly, if there's anything you kind of want to share to wrap up, and then we do have a couple of things to cover before we close out the session, but definitely want to give you all space to answer this one. So we'll start with you, Juan. If there's any advice you can give to folks, what would that be?
I think going off of the last question would be to remember your why when things get rough. Remember why you got into this work, and also remember why you are providing this service. I think oftentimes in the mental health system, we see services offered for folks, but it's just an offer. And I think being really intentional as to why we're offering that service and how we're building that rapport to that community that we're trying to support is really important, because we need to make more than an offer. We need to build a relationship with the community in order for the people to want to use it.
One thing I would like to say is really meeting people where they are. I think here we really just want to create those spaces and make sure that, we are asking them what is getting in the way of accessing and utilizing services. So not being afraid to ask them directly, what can we do to support you in accessing those services? So I think that's one thing I want. And then also another one is really deep listening, and take time to pause and listen to those that we're serving, those people that we're serving. And then like that, we'll take action.
Yeah, I just have to, for organizations, I would recommend really keeping update your resources. Just with everything that's been going on, a lot of organizations going remote, numbers changing, things happening. It's really, really important for organizations to keep updating their resource list and making sure that those resources even have the capacity. Because if we do hand off something and then they get, essentially rejected from that resource, they're just gonna have to restart and find a resource or a service again. So it's really important for organizations to remember that. The other thing that I just want to say, as just the people that we are in this space, in this world, is just to honor that you're still just a human being, and you don't always have to be empathetic. You don't always have to, care or things like that. It's okay to have those days. And I think that's something that we really struggle with, because we talk about how much suffering there's going on in the world. but we also need to remember that we're one of those people that are going through that. And it's okay to just, be a human and take your days and take it slow and really rely on your loved ones and the people that you trust.
First and foremost, thank you again for your time today. Thank you to our participants for joining us in this session. And with that, I just hope that everyone is well and healthy and that we continue to show up in these spaces, not just for those that we serve, but for ourselves. And so with that, we will see you soon. And thank you for joining us today. Bye, everyone.